Staff at Fiona Stanley Hospital are meant to screen patients to keep anyone with COVID out of the main emergency department. But that's not what happened when a mother and her sick child, both with COVID, arrived last night after being told to go there by health officials.
She presented to the triage unit and notified the nurse that she was positive and that her child was positive and was directed into the emergency department waiting room.
Even the mother knew it wasn't right, but was told to go in.
She questioned it, but was directed into the waiting room.
It was only when the pair was seen by triage staff inside the ED that the mistake was picked up. Everyone in the area was wearing masks and staff were in full PPE. But 5 families and 2 staff were still sent into isolation until they return a negative result.
This is being taken extremely seriously and a full review will be undertaken. Procedures are in place to protect staff and patients and they need to be followed.
What on earth has this government been doing over the last 2 years if they can't manage the most simple, basic triage protocols at Fiona Stanley Hospital?
The head of the nurses union says it was a nursing assistant who was relieving someone else that made the mistake.
It should only be a qualified nurse who is directing where COVID positive patients need to go.
But the minister says that's not necessarily the answer and that some procedures have now been changed.
What will be put in place is they will be directed to a particular emergency department and that emergency department will be notified and specific arrangements will be made to meet those patients.
She says further training will also be undertaken to ensure staff understand what they need to do. Kian Burke, ABC News.